Thank you everyone for joining us today for this exciting session on digital solutions for informed malaria control and decision-making amid the COVID-19 pandemic in Zanzibar. My name is Meedna Dalmata, and I'm a research and data analyst at Cooper Smith. I'm joined by our esteemed speakers who will be sharing how the PMI VectorLink Tanzania program harnessed digital technology to deliver life-saving malaria control interventions in the height of the COVID-19 pandemic. Through key adaptations in how data were collected, the team ensured information was available in real time for decision-making while practicing enhanced mitigation measures to protect personnel. Due to increased travel restrictions, the VectorLink Tanzania team used mapping functionalities to support day-to-day monitoring of an indoor residual spraying campaign for malaria prevention. The team built dynamic analytic products for granular program progress and coverage tracking, ensuring the protection of over 230,000 people from malaria in a brief 12-day indoor residual spraying campaign. The team also used analytic products to adapt and allocate resources towards community mobilization and measures to address reasons for non-sprayed structures. Before we jump into this topic, I would like to give a warm welcome to our speakers and a brief introduction. Jillian Berkowitz is an M&E specialist for the PMI VectorLink project, where she's been a technical lead for global DHIS2 system rollout. She has over 7 years of experience implementing ICT for D in support of global health programs. She first started working in DHIS2 supporting malaria programs 6 years ago. In her current role, Jillian specializes in bridging technology divide between complex public health programming and information system design and implementation. Before joining ABT Associates' VectorLink team, she was an ICT for D specialist with ABT's Data Science Division, identifying opportunities for use of technology to strengthen a diverse international development portfolio. Welcome, Jillian, and thank you for joining us. Our other speaker, thank you. Our other speaker, Grace Morabe, is a monitoring and evaluation manager in the PMI VectorLink project and is based in Tanzania. She advised the Tanzania project on M&E implementation and leads an M&E specialist department and field staff. Grace has 10 years of experience in M&E development interventions, focusing on economic strengthening of communities, nutrition, HIV/AIDS, cervical cancer screening, gender-based violence, and malaria prevention through long-lasting insecticidal nets and indoor residual spraying. Grace is an economics graduate from the University of Dar es Salaam. Her background in economics, working in public health, has led Grace to pioneer capacity building through training and data use for results-based decision-making. Grace and Jillian have been working together in support of vector control since 2017, first on the PMI Africa Indoor Residual Spraying project, and now on VectorLink. And the progress made and increased use of digital innovation in Tanzania is really a culmination of all these years of close collaboration. Thank you, Jillian and Grace, for joining us, and I'll now turn it over to you both.
Wonderful. Thank you so much, Madonna, for the introduction, and good morning and afternoon to those of you joining us today. I'm Jill, and I'll start us off by introducing our session on a topic that my colleague Grace and I spent a lot of time thinking about and working on, and that's how we can better use digital solutions for informed malaria prevention. All of this in the context of COVID this past year. So as a quick overview of our presentation, we're going to first give an introduction to our project and the context that we work in. Second, my colleague Grace will walk through how the PMI VectorLink Tanzania team used digital solutions for evidence-based decision-making to prevent malaria on Zanzibar Island amid the many challenges presented by the COVID-19 global pandemic. And lastly, we will save some time for a discussion and some questions. So who are we and what do we do? The PMI VectorLink project implements safe, cost-effective, and sustainable vector control interventions that have proven life-saving impact. Working across 24 countries in sub-Saharan Africa, in addition to Cambodia and Colombia, the PMI VectorLink project conducts robust entomological monitoring and equips countries to plan and implement integrated vector control interventions. These include indoor residual spraying and the delivery of insecticide-treated nets, with the overall goal of reducing the burden of malaria. Along the way, we are working hand in hand with counterparts to build capacity in generating and using data to make informed vector control decisions. Now, the project is funded by the US President's Malaria Initiative, which is an interagency initiative that's led by USAID and implemented with the Centers for Disease Control and Prevention. PMI was started in 2005 with the goal of reducing malaria-related mortality by scaling up proven and highly effective malaria prevention and treatment measures in high-burden countries. And at the core of all of our activities is being data-driven. Now, to give you a sense of scale of the PMI VectorLink project, this past year was year 3 of our 5-year project. And during that time, the VectorLink project sprayed over 5.7 million structures during our indoor residual spraying campaigns, which were implemented across 16 countries. The project distributed over 5.6 million insecticide-treated nets. And for these two interventions combined, the VectorLink project protected an estimated 31 million people at risk for malaria. As for entomological monitoring, because these data are so essential to informing integrated vector control decisions, the project conducted entomological activities in almost every PMI VectorLink country, and this included investigations in over 200 Sentinel sites. But today, we're really going to be focusing in on indoor residual spraying and exploring how digital solutions have enhanced our work. First, let me explain a little bit about the intervention itself before Grace goes in. Indoor residual spraying, or IRS, is the application of long-lasting insecticides on the inside walls, ceilings, and surfaces of homes in order to kill the malaria-carrying mosquito that land or rest on these surfaces. We deliver IRS through large-scale campaigns that are carefully planned with PMI, with national malaria control programs, and with important local stakeholders. The VectorLink project sends teams of skilled spray operators to areas that are targeted for spraying, with a goal of spraying at least 85% of the eligible homes in order to provide a community protection from malaria. IRS campaigns are implemented in short and intensive periods of work. They typically range from 20 to 30 days per year in a country. And these very large-scale operations have thousands of staff, and data are being collected by each of those staff at every single home that we visit so that we can monitor our progress and our results. So the volume of information that we are capturing on the project during this activity in a given year is massive. So with this brief introduction, I'm going to hand it over to Grace, and she's going to tell us more about how digital solutions have been used to meet project need and to advance our goal of reducing malaria from the perspective of the PMI VectorLink Tanzania program. Ultimately, the VectorLink project data needs, they're going to be rooted in our overarching program objectives that I just walked us through, and that's to implement evidence-based vector control programming across PMI-focused countries. Now, we characterize those needs typically as 3 main pillars to ensure that we can monitor our intensive campaigns, that we can understand our entomological impact, and that we can protect beneficiaries within time and resource constraints. So first, we need efficient data collection systems for documenting our program progress. Then we need to have standard data entry and data cleaning practices to ensure high quality information. And finally, we need tools to visualize these data to not only drive real-time decision-making about our campaign progress, but to inform future vector control interventions. And so for today's discussions, we're really going to focus in on how we use digital. And in this case, it's mobile data collection and tracking progress and coverage through dynamic dashboards, results-based decision-making and program adaptation, and all within the realm of COVID-19 and discussing the prevention measures during the Zanzibar IRS campaign. Now, Grace, I see that you're back. Are you able to step in here? Awesome.
Yes, sure, definitely. So the VectorLink Collect overview, as Joe had explained earlier, it aims to support the myriad data needs across VectorLink project activities. So the team developed a global streamlined information system. We call it the VectorLink Collect. It's built on the DHIS2 platform, and the VectorLink Collect is a single DHIS2 instance that serves as a one-stop data shop for our project data. We have 4 dedicated servers at all times to accommodate for concurrent activities, iterative program development, different country training schedules, etc. In 2019, Tanzania was one of the first countries in VectorLink project to pilot VectorLink Collect database. Since then, the VectorLink Collect database has been used in IRS campaigns, from data entry to dashboards. The system has unified standardized the data management process that is accessible, easy to use, and multifunctional. Digital solution for decision making. Zanzibar IRS campaign overview. As of this year, between 13th to 17th of February 2021, we had our first full-on mobile spray, which took place within 12 work days, and it was specifically for Zanzibar. In this case, we targeted shehias or lower levels that had high malaria incidence rates. Overall, we engaged around 464 workers who were trained and were throughout involved in delivering the IRS intervention to communities. We aimed to spray around 45,000 structures in multiple shehias in 10 districts that were in Zanzibar. The minimum required spray coverage, which means the number of structures that we end up spraying out of all structures that we find in the field, is targeted to be 85%. Now, how do we use real-time data for decision making? Amid COVID-19 implications on Zanzibar IRS, there were different adaptations that had to take place to ensure that we protect the communities from malaria, at the same time making sure that the activity does not cause an even more spread of COVID-19. In implementation of IRS, the COVID-19 pandemic became a hurdle that provided a learning and adjustment experience. Despite several challenges, the activity was successfully implemented. Some of the challenges that came up spraying during COVID-19 included limited training groups and group discussions. We had to make sure that we minimize the number of people that we train in a specific venue, and had to narrow it down from what used to be 90 to 100 to close to around 25 to 30 people per venue. In this case, we had to make sure that the trainees were spaced out, and when there were discussions, they would be group-wide, but at the same time, people don't have to get in too close, and make sure that they always wear masks throughout the trainings. Having multiple groups to train meant that we needed multiple people to support the training and multiple venues to accommodate the extra groups of people. And this was addressed by trying to stagger the mobile training so that we can have different sessions with different groups and have enough time with the trainees as we went along. We also hired what we call monitoring and evaluation assistants who would move along with staff to training venues to make sure that there's someone present in case there's any question that comes up during training. There was also additional information that was added in the training slides just to make sure that people understand the risks behind spraying during COVID-19. making sure that they are aware on limiting the interaction between communities and the spray operators who go to those households. It also included creating specific messages to inform spray operators on how to disinfect their devices. There was also limited in-person verification of data. So previously, during spray, we'd always go back to places that were sprayed, for instance, 2 to 3 days prior, to make sure that what we sample out from the community as a potential spray coverage matches the exact data that you receive from the spray operators. Unlike other years, due to COVID, this year we were not able to do that, but instead the mobile data collection helped us during the process to make sure that we identify exact households that were visited, the spray status of the specific shahias that were visited, and so forth. And this was also compensated by having extensive ongoing supervision as the campaign was taking place. There was also an issue of additional procurement process due to additional precaution from COVID. This included alcoholic-based wipes, of course, the phone devices, having an additional budget to send out job aid messages to spray operators to remind them constantly throughout the spray that they should be mindful and take precaution. And those precautions included washing hands when they reach to households that they're going to spray. This also included wiping their devices, washing their hands, maintaining distance with the homeowners, and so forth. And this also included reminding SOPs to always put on the masks. Throughout IRS, it's a standard protocol for spray operators to wear their full protective equipment, PPE. But this time, because of COVID, we had to harp in on that just to make sure that we are consistent in protecting communities, not only from malaria, but also from COVID-19 transmissions. Now, for full-scale mobile data collection, during IRS, the data timeline is of the essence, because the quicker that we get the information that is clean and clear, it will be easy for us to also make timely decisions as the campaign is ongoing. Because given the number of spray days, which were 12, it means we had limited time to get information and take action or make decisions based on the data. Now, in the mobile DHIS2 event capture application, in Zanzibar, we managed to use it in all 15 sites, and this was an upscale from last year, where we introduced the mobile application to only 2 sites. This also replaced the previous paper-based data collection forms. The data collection forms were also used in Pemba Islands and remote areas that previously, including last year, we had issues in making sure that we get the reports on time. So this helped in making sure that we have timely data in our systems, in our VectorLink Collect database. The IRS approach that was used in Zanzibar is what we call target IRS, focusing only on 68 shahias that seem to have very high prevalence in 10 districts out of 11 that were in Zanzibar. And just to also highlight on that, for the time being, Zanzibar is in the malaria elimination stage and no longer in malaria control stage, meaning that cases are identified individually by location. In previous times, paper foams were packed in SOP bags and were used in the field throughout. They were being assessed and checked by different levels of supervisors at the site level. For this year, since we are using mobile phones to collect data, the paper forms were packed in SOP bags, but in this case, they were only to be used in case of emergency or if there was any malfunction on the forms. That was a rare occurrence, but we also understand that using technology can also come up with a few challenges since they are devices. It's scenarios where the paper forms could be used where, for instance, broken phone screens, errors in accessing the DHIS2 event capture application, and in the events where the forms, normal paper-based forms were used, then they would follow the normal data flow to make sure that they reach the data center within the 24 hours after spraying. During the implementation, there was also mapping, where maps were used on analytics dashboard to inform both the project and stakeholders on continued progress and areas that needed additional supervision. This identification layer of information coincided with other analytics based on the data that we're receiving from spray operators and provided an understanding on where to allocate intensive supervisory support. This also included identifying places where we can intensify community mobilization, and we would determine that based on the spray coverage, meaning if we had locations or shahias or districts that seem to have more structures that were found, but at the end of the day, the number of structures that ended up being sprayed was below the 85% threshold, then that means that community is probably aware of the activity, but however, they somehow have reasons for not wanting their houses to be sprayed. And now that would also go along with further investigation on why they didn't want their households to be sprayed, whether it was, for instance, rain season, or maybe someone was sick, they have other cases of sick people in the house, or maybe it was refusal, or maybe they went to the farm or to the to harness seaweeds. That's why they closed their homes and their homes couldn't be sprayed. So we had to do different investigation, make sure that we allocate the right resources, whether it is community mobilization, adjusting times to go to visit these households, and so forth. Throughout the campaign, for the 464, we had around 464 live devices that were collecting the data throughout the campaign. On results-based decision-making and adaptation, this also has to do with how we use the results that we get, how we use the dashboards. What does the data communicate to us as a project during a live campaign? Due to real-time data, the project was able to make adjustments from the spray results. This included spray coverage trends by site, the adaptation on sites that had low spray coverage in first week of spray. District level meetings were held on how to improve mobilization efforts. It also involved more local leaders in mobilization in addition to shehas. Shehas who are known as the shehia level leaders. We also hired additional spray operators in struggling sites to ensure that more and more structures are found, documented, and are sprayed at the end of the day. On spray progress trends, spray progress, we checked the number of structures that were sprayed from the overall target that we had as a project for Zanzibar. In this case, it projected any possible need for insecticide and IRS materials during the spray. And in Zanzibar overall, there was no specific need because during the planning process for the spray, we made sure that we had reserve and buffer for most of the items so that we don't experience any shortage. But having the dashboards communicate that to us gave us time to recheck whether what we had planned for is enough for what we are seeing as results as we continue to spray. If we are seeing more structures, does it mean that we have enough insecticide for the next, let's say, 6-8 days until the end of spray, and so forth? It also identified shahias that needed more focus during revisit based on spray progress and coverage. So from the spray coverage, after seeing some of the shahias that did not have as good of spray coverage as we had targeted or hoped for, which would be 85%, the next step, as I had said earlier, was on mobilization. And following that, we have what we call revisit or mop-ups, where after we have finished spraying a specific shahia, we check if there are any issues. If there were, then we have to remobilize the houses that were not sprayed, so that during revisit, we don't experience the same challenge when the spray operators go back to spray them for the second time, or for the second round of visit. There are also issues on reasons for unsprayed structures, which meant addressing refusals, locked structures, and mobilization efforts. And the maps helped us a lot in pinpointing or identifying areas with very low spray progress and spray coverage. So throughout the spray, the main thing that changed this year or shaped how we sprayed this year is on how we managed to protect communities from malaria, and at the same time making sure that all the people in the field adhere to COVID-19 prevention measures. As a precaution throughout, staff were supplied with masks, which is a standard in IRS. They were also supplied with alcohol wipes to clean their devices, their own hands, and so forth. They're also supplied with hand washing stations at their sites. But when they go to the communities, the emphasis was put on requesting for soap and water to wash their hands before they engage in anything with the homeowners. For instance, helping in preparing the houses. There was also an issue on spacing, and the national COVID-19 guidelines were shared and were reminded of throughout the spray campaign. Staff were also supplied with wipes, as I had said previously, to make sure that they disinfect their devices. And during the checking of the data on their phones, those data were also being reviewed by their team leaders. So whenever the spray operator shares the phone with the team leader for review of their data, they have to make sure that any exchange of phone from one hand to the other comes with the disinfection of the devices, because we didn't want to have any cases that pop up at the spray sites also. There was also an upscaling of mobile data collection, which helped in COVID-19 prevention, and it reduced the risk in handling the paper-based report forms. So in a standard IRS spray, the data, when it's collected in a normal form, it moves from the spray operator's hands to their supervisors, who we call the team leaders. The team leaders review them, and then they share them with the site supervisor. who also cross-checks just to make sure that the data is correct, it's accurate, it doesn't have any errors that don't make sense, if that's the right word to use, logic checks and so forth. When the site supervisor is okay with the forms or the data, then they would be transported to the data center. At the data center, it's where we used to do the data entry of the report forms that come to the center. These would be later uploaded in the DHIS2 system, which we call VectorLink database. Now, introducing the forms meant reducing the handling of the forms. With the forms, the data went straight to the phone. These same information were later reviewed by the team leaders, who are the direct supervisors of sprayers or spray operators. And once they're okay with them, they would later submit directly the reports to the VectorLink Collect database. In this case, it reduced the amount of time it took for the field data to reach the servers or VectorLink Collect database, and it also reduced the hands that worked or processed the forms. To make sure that we don't lose the integrity of the data that we have, we made sure the forms in the phone had logic checks, had alerts that would remind someone that this place hasn't been filled, this information that you put doesn't have any logic, to make sure that we minimize the errors as much as possible. The overall key takeaways from the discussion is that the PMI VectorLink project used mobile data collection for timely data collection and decision making amid COVID-19 pandemic by, first of all, upscaling the use of mobile phones from only 2 sites to 15 sites, which covered around 464 spray operators. There was also using dynamic dashboards to monitor spray performance trends and address reasons for unsprayed structures, meaning do a thorough or brief investigation given the limited time period of spray that we had, which was 12 spray days. Also using maps to monitor spray coverage by locations and identify specific areas or sites or districts or shahias that had problem reaching their targets throughout the campaign. And also adapting approaches based on daily results to ensure that there's efficient operation. In this case, as I had mentioned previously, to make sure that we have the right quantity on IRS materials, to make sure that we have enough insecticide if we're finding more structures in one place, to make sure that we mobilize communities and adapt to the need at that specific moment in time. And also there's adherence to COVID-19 guidelines in protecting both communities and field staff as we spray. Gillian, back to you.
Thanks so much, Grace, for that excellent overview of the Zanzibar campaign. I think it's clear that this year the team went above and beyond and harnessed the power of digital solutions to ensure that we could continue with our life-saving implementation of IRS on Zanzibar. So I think, Madonna, we'd love to take any questions from the group or see what else might be interesting to discuss.
Thank you both, Jillian and Grace, for that presentation. It was great to see how reactive and adaptable your project was to such an unforeseen crisis. Just want to reiterate that in the Q&A chat to the right of the chat box, if anybody has any questions, just to put them in there and we can get more information on the project. I think while everyone types their questions, I will just kick it off. I would love to hear more about how, because of COVID-19, there have been a lot of conversations about infectious disease and prevention measures. Do you think that or did you find that those conversations around prevention, around infectious diseases had an effect on either the workers or the recipients and their perceptions around malaria at all?
That's a great question, Madonna, and I'm gonna put Grace on that one, given that she was there to support the campaign.
Thank you, Jen. So I think the concern prior to spray was that what will we prioritize the most, either malaria prevention or less interaction with communities to ensure that there's no spread of COVID. And I believe there was a continuous debate on that up to the point when we started to spray. So choosing or deciding which one is more important than the other, to us, it really made sense, first and foremost, to make sure that we protect the communities from malaria. But at the same time, we had to be very sensitive and very serious in making sure that our efforts in trying to protect communities from malaria don't result in having hotspots of COVID-19 cases. So I think the fact that we're able to tackle both without having any issues, I believe that also showed a positive light in the community's acceptance of spray, and also them taking their part or role in making sure neither us nor them cause any spread of COVID throughout the campaign.
Yeah, I think that makes a lot of sense, and I'm sure it was a really hard debate to have, trying to figure out what the cost benefit of that would be. I haven't seen any questions come through, but would love to hear if you guys have anything else to add about the project, any of the other work that you're doing, and how COVID might have affected that.
Yeah, just to say that, overall, the VectorLink project has been an incredibly resilient operation over the last year. There's been a commitment to the mission of our program to protect beneficiaries from malaria. And we have, I think, all of our country programs around the world have shown their commitment and adaptation to COVID-19. So it's just been a great and challenging year for us. But thank you for the opportunity for us to share the experience from Zanzibar.
Yeah, thank you so much, both of you, for presenting. This was really great and interesting, and I appreciate you taking the time. I think with that, we can wrap it up a couple of minutes early, but thank you so much.